The Dr. Fazil TV show is brought to you by POYA, People of Yuma Health Association. The Dr. Fazil TV show is intended for health educational purposes only and complies with all the HIPAA regulations.
My name is Jose and welcome to the Dr. Fazil show. Today's topic is going to be on coronavirus and updates on the coronavirus that has affected us all.
Thank you, Jose. As you said, today we're going to be talking about coronavirus epidemic, new updates, treatment options, screening, and impact on all of our lives. And again, I'm sure most of you know me. I'm Dr. Fazil. I'm one of our internal medical specialists as well as a kidney specialist. And as Jose well said, you will have opportunity to ask the questions at the end of our discussion. Thank you so much for being here and be part of this part of the discussion.
Dr. Fazil, most of our audience members want to know what exactly is the coronavirus?
Jose, that's a very good question. So the viruses, they are different kinds. Coronavirus is one of the many cold viruses which we get during the winter time. It is not a flu virus. It is actually an RNA virus, and it is spread through droplet infection. It's very contagious, and nobody knows where it originated from at this point, but the most likely the chances is, since we got the first cases from China, that it came from China, and that's where it originated from. So it's a respiratory infection, RNA virus. There are two kind of genomes. One is known as RNA, and one is known as DNA. So this is a single-stranded RNA virus.
And Dr. Fazil, are we out of the woods yet?
I think the time will tell. I think it might be too early as we don't have a treatment for an effective treatment for this virus yet. Invisible enemy, I would call it, as well as we don't have the vaccination yet. But I think with this not able to open the businesses, and there's a lot of economic pressure and global economic pressure to open up the businesses with precautions, with social isolation, precautions to prevent droplet infection, and following the basic hygiene guidelines. As long as we follow those precautions, I think we should be fine. But as I said, we do not have the treatment or vaccination available at this time, which might take us a longer period of time. I don't think we are totally out of the woods yet at this point.
Okay. And Dr. Fazil, are you aware of any treatment available at this time?
Jose, that's a good question. At this point, there's a new antiviral medication which just got approved for the urgent use or emergency use, remdesivir. It has shown that it has shortened the sickness phase by 4 days instead of 15 days to 11 days. But other than that, I'm not aware of any new treatment which is as effective as this medication is available yet.
And what are the typical symptoms of coronavirus, Dr. Fazil?
So the typical symptom of the coronavirus is dry cough, fever, if it remains up to the upper respiratory tract, but it can go to the lower respiratory tract, which is lungs, and cause respiratory failure, shortness of breath, even to the extent needing the ventilators. And typical myalgias and body aches and pains, which you generally get with the flu virus, you do not get with the coronavirus. So that's the main difference.
When the new cold virus comes in the winter months, what could we expect?
So, Jose, I think as long as we don't have the effective treatment or vaccination, I think since this virus has a tendency to mutate as well, and we know the flu virus start in month of October each year and then go up to April, I think then we will have two enemies to deal with at the same time. So mortality might be higher than what it is now, because if you're sick with flu and then you get coronavirus on COVID-19 virus on top of that, it might be more dangerous. But the good news is we already have vaccine for flu virus. So I highly recommend that everybody who's supposed to be vaccinated for flu should be vaccinated early enough in the months when it is required. Then we don't have to worry about the flu too much and just focus on the coronavirus or COVID-19 virus.
And Dr. Fazil, how long will it take for the vaccination to become available to us?
So unlike treatment which can be used on urgent basis or on emergency basis, a vaccination is given to healthy persons. The preparation phase and testing phase is typically very long. The earliest I'm thinking, if everything goes right and everything works out, is at least a year from today. And we know that virus mutates, so once we get a handle on this virus, then every year it will become like a seasonal flu, and then every year we'll have a new vaccine for this deadly virus. So answer to your question would be year to year and a half where the vaccine will become available, because we'll have to test on the healthy individual that not only they get benefit, but also they do not get any side effects from using this vaccine on the massive level.
And in your opinion, do you think it's a good idea for businesses to start opening up anytime soon?
It's a very important question. It's more than a medical question. I guess the answer would be, as long as there's a federal guidelines for keeping this invisible enemies or Chinese virus under control, if you follow the proper precautions, like social isolation, which is follow up 6 feet or more of distance between each other, using masks, and as long as we can follow those precautions, testing, as well as as long as we can practice the safe federal guidelines, we might be able to open the new businesses, but we don't know if it is going to come back with more severity if we open up the businesses too soon without following the proper guidelines, because we have not got the treatment available yet, and we have not have the vaccination available yet, although we are more prepared than before to handle the crisis, medical crisis, if it may happen. So I think that time will tell. It's too soon to answer this question.
And Dr. Fazil, the most important question is, when should we go see a doctor?
That's a very good question. So since we don't have the treatment available or vaccination available, the only time when a person should seek medical attention or going to the hospital would be when they have shortness of breath, because that's the time when they can actually, if it gets worse enough, they will have to put the patient on the ventilator or breathing machine. Otherwise, if just a cough or fever, and it's probably going to get better by itself, and you're going to develop immunity against this deadly disease or Chinese virus. So the answer is, when you get really short of breath and you cannot breathe, or you think you have impending shortness of breath, that's where you should go to see your doctor or go to the hospital.
Thank you for being with us today, Dr. Fazil. Now we're going to go ahead and open up for audience questions.
Thank you, Jose, for having me today, and I will love to answer the question to the audience.
Dr. Fazil, our first question is from Cindy in the audience. She asked, again, when should we go see our doctors?
Sandy, thank you for asking that question. As we just mentioned, you should, or anybody should go to the doctor or to the hospital when they are short of breath. That means they cannot breathe at their own, or they think they're not going to breathe at their own, because at that time they will need an assistance of the doctor to put them on the breathing machine if it becomes severe enough.
All right, Dr. Fazil, our second question is from Ron in the audience. He asked, how high a temperature should we get alarmed before we go seek medical attention?
So Ron, the question is, Ron asked question that how high the temperature has to be before they seek the medical attention. Ron, the fever is not the concerning part. That is just the symptom of a coronavirus. If you get fever, just like any other fever, take Tylenol. Stay away from the NSAIDs like ibuprofen and stuff. You should be more worried to see a medical doctor or hospital only when you're short of breath. It's not the fever, it's the shortness of breath. That's the important distinction, because we want to keep the health system available for those patients which really need them, and not for just for the fever.
All right, Dr. Fazil, our third question is from Betty in our audience. She asked, once you recover from the COVID-19, can you get it again?
That's a very good question. At this point, we're thinking that it might be true that you might become immune to the COVID-19 infection if you do recover. We do not have any evidence at this point because it's too early, but we also do know that it does mutate. So if the virus mutate and now it is a different virus than what you had in the initial phase, you can get a reinfection. So we still have to follow the social guidance and federal guidance to prevent infection, because we are in the uncharted territory at this point.
Thank you for being with us today, Dr. Fazil, and giving us that useful information. Audience, stay tuned for our next episode of the Dr. Fazil Show.
Thank you, Jose, for having me today in the Dr. Fazil TV show. Hopefully everybody's safe. Please be safe. Let's see how the things unfold. And God bless us all. And God bless America.